You can come in.
As I enter my patient's room, I'm gelling in the door and donning on my first pair of gloves. Hi, nice to meet you. I'm Tyler. I'm with the respiratory team here at the hospital. Do you mind telling me your full name and date of birth, please?
Tyler Bolin, September 8, 1998.
Thank you. Do you mind if I verify the wristband, please? Cool, thank you, miss. Alright, so I heard you're getting discharged today. Congratulations. We're going to give you a couple treatments to take home with you, just so you stay out of the hospital longer, okay? Before I explain you those medications, do you mind if I check some pre-vitals?
Go ahead.
Cool. And so for the pre-vitals I'm going to be taking, they're going to be heart rate, respiratory rate, and breath sounds. Also saturation. So to start off, I'm going to be plugging in my pulse oximeter into my patient's index finger. So do you mind showing your hand? Thank you. And then after I've placed that, I'm going to be checking their heart rate by checking their pulse. So do you mind if I see your wrist, please? All I'm going to be doing is checking your heart rate, okay? And then I'm going to be holding this for about 30 seconds, and then after that 30 seconds, I'm going to be monitoring the respiratory rate. I've noted that my patient has a heart rate of 89 beats per minute. And then as I'm still holding their pulse, I'm monitoring their respiratory rate, so my patient has no fear and changes their breathing pattern. And I've noted that my patient has a breathing pattern of 13 breaths per minute, and then after I'm going to be checking my patient's breath sounds. So all we're going to do lastly is check your breath sounds. I'm just going to be seeing how you're breathing through my stethoscope. Is that okay?
Okay.
Cool, so we're going to be doing 6 breaths on the front and 6 on the back, okay? Alright, so to start off, can you take a deep breath, please? Thank you. One more. Thank you. Thank you. Thank you. Thank you. Cool. And then we're going to check your back breath sounds, okay? So, deep breath, please. Another one. Okay. Another one. Cool. And then last two, can I have you sit up just a little, please? Thank you. And last one. Alright, so your breath sounds are pretty clear. You're all good to go. So I'm gonna explain you your treatment. So your first one you're gonna be taking home is this albuterol inhaler. This is going to be your rescue inhaler. I know you have some exacerbations, you know, those feelings where you can't breathe and you have that sudden fear of shortness of breath. This is going to be your rescue inhaler, so whenever you feel like that, you can give this 2 puffs. Whenever you need it, you're not going to have a scheduled time to take this medication. It's going to be used only when you need it, okay? So just remember that it's 2 puffs at home, but we're going to be doing one here just to demonstrate that you know how to do the procedure, okay?
Okay.
So to start off, you're going to uncap your inhaler. And then since we haven't used this before, you're going to prime it. And what that means is you're going to actuate it to the side. And all it does is checks if your canister works and to expel any artificial artifacts in the mouthpiece. So after that's done, you're going to check in the mouthpiece, see if there's anything in there. And if not, then you're all good to go. You just shake your inhaler to make sure that your medications are mixed correctly. And then you can take your medication. So I'm going to be giving you this spacer with your inhaler, and what that should help do is hold the medication in this chamber, and you can breathe that in whenever you like. So you don't have to. There's not going to be a time where you're missing any medication because it's going to be held in here. Okay? Do you mind demonstrating that procedure for me, please? And then remember to hold 10 seconds after each actuation. Okay? Cool. So just remember to hold for 10 seconds or as long as you can. Okay? Cool. Thank you. All right, so I'm going to put this to the side. Remember, you're going to be taking this home with you. And then your second medication is this Advair Discus. Have you heard of that before?
No.
So this is going to be your maintenance therapy. It's a combination of 2 drugs. They should be helping you in the long term. You're not going to be feeling any improvement right away, but they are going to help you after a longer period of time. The way you use this device is you hold this tab right here, and then you slide it all the way to the back until you hear a click, and that means that your medication's punctured and it's ready to be inhaled. The main thing to remember with this device is you have to hold it either completely flat, or the medication might spill out to the side due to tilting or anything. Okay, so if you want, do you mind taking this medication? And all you have to do is just inhale. Okay. Cool, sounds good. And then to reclose it, all you gotta do is slide the port back to the beginning spot, right? And then I'm gonna leave this with you, so you're gonna be taking both of those medications with you today. You may feel a little jittery, or your heart rate may increase a little bit. That's just some side effects of the drug. They should wear off in a couple of minutes, but they shouldn't be left with you for more than 5 or 10 minutes. How do you feel after those medications? Are you all right?
Yeah, I feel pretty good.
Cool, sounds great. Do you have any questions about your medications, or when the time you should be taking your medications?
No.
Cool. All right, so that's all I have to give you today. Before I let you go, I'm just going to do some post vitals and see how you're doing after the medications, okay? So to restart my post vitals, I'm going to be rechecking my patient's heart rate and respiratory rate. So do you mind if I see your wrist again, please? Thank you. And then I'm going to be holding their heart rate. I'm going to be checking their heart rate for about 30 seconds, and then I'm going to simultaneously check their respiratory rate for the second 30 seconds, completing a minute, and then I'd multiply both values by 2 to get the whole times. So I'm noting that my patient still has the same heart rate of 89 beats per minute, and then I'm going to be monitoring their respiratory rate. And I've noted that my patient has a respiratory rate of 14 breaths per minute, so thank you. And then just to finish off, I'm going to be checking your breath sounds, and while I'm checking your breath sounds, I'm going to reattach my pulse oximeter to check your saturation, okay? So I'm going to be plugging this into your finger, and then I'm going to be checking your breath sounds, okay? So do you mind taking some big deep breaths? Thank you. Thank you. Thank you. Thank you. Thank you. Cool. And then lastly, I'm going to check your breath sounds on your back, okay? So big deep breath, please. Thank you. Thank you. Thank you. Thank you. And last one. Cool. All right, Ms. Bolin, your breath sounds are very clear. It seems like the medication has really worked. So if you don't have any further questions for me, please let your nurse know if anything changes, if you feel a little bit jittery, and then she'll come and let me know, okay? Cool, so thank you. And then as I'm exiting my patient's room, I'm gonna be disposing of my gloves in a safe place and then gelling back out. To finish my questions, the mode of action of albuterol is to cause smooth muscle relaxation by agonizing the beta-2 adrenergic or beta-2 receptors in the body. And then the mode of action of Advair is a bronchial smooth muscle relaxation, and then to stop the contraction of smooth muscles from tightening. And then the prominent side effects of Advair would be an increased heart rate, an increased respiratory rate, and or nausea. Those are the main ones that can be shown in the hospital site. And lastly, the best way to assure your patient can properly use a therapeutic delivery device would be to have them explain it back to you or just to demonstrate the procedure back. And that is my presentation on an asthma patient taking 2 medications. Thank you.